My daughter woke us up in the middle of the night the other night saying, "Mummy, Daddy, there's something in my eye. I can't get it out. It really hurts and I can't open my eye." And she was clearly very distressed about it. And once we'd calmed everything down, it made me think about this is a really helpful cycle to be aware of if either for you as an adult or one of your kids worries about health sometimes, because that seemed to be what the worry was about. So your typical cycle is there's a symptom which makes me feel anxious, and it might be that I've noticed my heart's beating fast. It might be that my chest feels a bit tight. It might be that I've got a headache. It might be that I've found a lump somewhere. There's a symptom and I'm anxious. Usually, the difference between symptoms we get anxious about and symptoms we don't is our interpretation. So in my daughter's case, the symptom she felt was pain and she felt like her eye wouldn't open. She never expressed any of the thoughts, but generally speaking, the fear that goes through our minds with these ones is that something is wrong, that it might be a result of permanent damage, or there might be a catastrophic thing that would happen. So I've got a headache, what if it's a brain tumour? My heart's feeling sort of weird, what if I'm going to have a heart attack? My eye won't open, what if that's going to be the case forever? What if I'm always going to be in pain? Or what if I'm going to lose my eye? That might not be a conscious thought, but it's a feeling of that it's wrong, or that it's not going to change, I'm never going to get out of it. That's a panicky feeling. Once you get anxious, your heart starts pounding. And that, generally speaking, makes the symptoms worse. So in my daughter's case, there's her eye, she's been rubbing it a lot, and her heart will be pounding, so she'll be feeling her pulse in her eye as well, which makes it feel weird too. And what she was doing a lot, which is what we all do, is rubbing, poking and prodding. So she was rubbing her eye a lot, trying to do this, trying to sort of rub her eye. Makes total sense, but it wasn't helping. So knowing all of this helped me understand how to react. So first thing was, are you feeling scared? Okay, come and sit over here. And just to give her a cuddle. This deals with some of this, brings that down a touch, right? Then it was saying, I'm not sure that the rubbing is helping. Shall we see if we can just stop rubbing for a minute and see if that calms things down? And so she stopped, she said, it's not helping, it's not helping, it's not going away. I said, okay, let's just give it a minute. I'd like to be able to look, because sometimes when you've had something in your eye, even when it's gone, you can still feel something there. So let's look and see if there is anything. So once she was calmer, she allowed me to open her eye, and there we go, there was nothing there. I said, okay, there isn't anything there, but you'll probably still feel it for a while. Let's see if we can practice opening your eye and sitting with it for a while. And again, really what I'm thinking is, let's just help her calm down a little bit. And that was it. So in health anxiety, stopping this behaviour is usually a priority, and then helping myself settle a little bit will usually stop the whole cycle.